There's a growing number of coronavirus outbreaks in Spain. This after the nationwide confinement order, which went on for more than 3 months, was lifted about a month ago, and people started moving around the country and getting together for social events. Since then, there have been more than 150 outbreaks, some of the worst in the northeastern region of Catalonia. One involves seasonal farm workers who pick peaches and pears and live in close quarters. Another is in Barcelona and a nearby city. Officials there have asked Barcelona residents to stay home, but it's not mandatory. Spain reported more than 600 new cases on Friday, the highest daily number since early May. Spain has been one of the hardest hit countries in Europe by the coronavirus, with more than 28,000 deaths and more than 260,000 cases. Officials promised contact tracing and quick isolation of any new cases, but critics say that has not been uniformly implemented across the country. As Spain tries to avoid a full-scale second wave, the wearing of masks is mandatory now in public at all times in most parts of Spain.
When Luis José left his native Venezuela to find work in Peru, he hoped to wait tables or maybe mix cocktails for tourists. And for a while he did. But as the pandemic hit, Peru imposed a lockdown and he lost his job. Now Luis José collects the bodies of COVID victims for the local government and takes them to be cremated. He makes $500 a month. Luis José and his compatriot Nestor pick up over 20 bodies a day. Few jobs carry the level of risk these men face every day. There's little time for solace at Lima's El Ángel cemetery these days. This is the new normal, if you can afford it, the high-speed burial. Only 3 family members can attend, and it lasts just 10 minutes. Others can only pay their respects virtually. Another family consumed by grief in a country on its knees. And here is where you end up if you cannot afford a burial site. In a cardboard box at the crematorium where the smoke of death never stops. Most of the workers here are also from Venezuela. Orlando is one of them. He works 12 hours a day, 7 days a week to support his 4 children back home.
Alguien tiene que hacerlo. Y la necesidad que tenemos nos lleva a eso. ¿Ok? Porque lo del país, eso los peruanos no lo hacen. Fuerte, fuerte. No se lo deseo ni a mis peores enemigos.
Orlando is in charge of the ovens. He never imagined he would see so much death.
¿Y cómo hace si un colapso? Todo está lleno. Hay cadáveres que mantenemos en otra área porque ya no nos caben, entonces no los podemos dejar afuera.
By nightfall, Luis José and his team have already collected 15 bodies from Lima's most affected neighborhoods. But the day is far from over. Raúl Olivares was 63 and COVID killed him in 3 days. The family called an ambulance to take him to hospital, but it never arrived. So they simply had to watch him die. At 11 p.m., the men get a final call from the Villa María del Triunfo hospital. They have to collect 13 more bodies because the fridges here are full. While they wait for the paperwork, they grab their first bite to eat in hours.
A veces llegamos a las 2 o 3 de la mañana. Llegamos a la casa mientras que nos bañamos, comemos. Hacen las 4 de la mañana, después salí a las 8 o 9 de la mañana otra vez, hasta seguir todo el día.
Siempre compramos algo en las tiendas.
Despite these challenges, José Luis has taken something positive from this experience.
Yo vivo el día a día. Vivo el día como si fuera el último.
These men left the country in search of a better life. They still hope to find it.
Cuban officials on Monday said that for the first time since the beginning of the pandemic, they had recorded 0 new coronavirus cases. In addition, there were no fatalities, Cuban health authorities said, and there are no patients in hospital with the coronavirus that are in critical condition. Cuban health officials said they have not completely eliminated the coronavirus on this island, but they feel that their program of closing borders, of extensive contact tracing, of obligating everyone who was sick and many of their close contacts to go into hospital here, and as well making it mandatory that people wear face masks in public, that all of those measures have worked and that they have bent the curve, and that in fact they believe now that they have the spread of this virus under control. It's been over 2 weeks since much of this island has begun reopening. That means public transportation is back up and going. Many businesses, even the beaches, have reopened, and we've not seen a spike in cases. So all this says allows Cubans to feel somewhat more comfortable as they begin to reopen this island. But of course, it's still yet to be determined when this island will reopen airports and seaports. The first cases that came to Cuba were brought in by tourists, and of course, this island's only 90 miles away from the state of Florida, where the coronavirus is raging out of control. There's still a lot of concern that once Cuba reopens its borders, that it could introduce new cases. Cuban health officials on Monday said that they believe there's still some asymptomatic cases out there they have not detected. So they're not lowering their guard yet, but they say that their strategy against the coronavirus in Cuba is working. Patrick Ottman, CNN Havana.